What if I told you that your heart might be the real reason things aren't working in the bedroom? No, it's not just aging, and it's definitely not just in your head. Every 34 seconds, someone in the US dies from heart disease. But long before the chest pain, shortness of breath, or collapse, many men report something else: trouble with erections. Erectile dysfunction is often the first quiet warning sign your cardiovascular system is in trouble. In this video, we're exposing the science, the risks, and most importantly, what you can do starting today. Erections aren't just about desire, they're about blood flow. When you're aroused, your brain sends signals that relax the muscles in your penis, allowing blood to flow through the arteries and fill the erectile tissue. But here's the catch. If those arteries are narrowed or blocked, even slightly, that process breaks down. And the most common cause? Atherosclerosis, or the buildup of plaque in the arteries. The arteries in the penis are much smaller than the ones in your heart. That means they can show signs of trouble years earlier. Think of ED as the canary in the coal mine. It often shows up before chest pain, before fatigue, even before you know you have high blood pressure or high cholesterol. Studies from the American Heart Association and Mayo Clinic confirm that men with ED are significantly more likely to develop cardiovascular disease within the next 3 to 5 years. That makes ED not just a quality of life issue, but a potentially life-saving clue. And here's something even more eye-opening. Many men who suffer from silent heart disease, the kind that shows no obvious symptoms, first visit a doctor because of ED. That's how powerful this link is. If you or someone you know is experiencing erectile difficulties, don't dismiss it as just getting older. It could be your body's early alarm bell, ringing before it's too late. Let's be clear. Erectile dysfunction isn't just a bedroom issue, it's a vascular issue. In fact, the penis is one of the first places where poor blood flow becomes obvious. Why? Because it requires a precise balance of healthy arteries, smooth muscle function, and proper nerve signals, all of which are influenced by your cardiovascular system. When ED starts, it's easy to assume it's just stress or age. But in many cases, it's a sign that your blood vessels aren't working properly. Doctors call this endothelial dysfunction, a condition where the lining of your blood vessels fails to dilate as it should. It's an early marker of cardiovascular disease and a major red flag. Conditions like high blood pressure, high cholesterol, obesity, and type 2 diabetes all damage blood vessels. These same conditions are also among the top contributors to ED. That's not a coincidence. They're part of the same chain reaction, starting with vascular inflammation and ending with reduced circulation to vital organs, including the one that matters most during intimacy. According to the Cleveland Clinic, men with ED are up to 80% more likely to develop heart problems down the line. That's not a number you can afford to ignore. And Harvard Health reports that in some men, ED is the first symptom of a hidden heart issue, even when all other vital signs seem normal. So the next time you hear someone joke about ED, remember, it's not funny. It's a health warning. One that, if ignored, could lead to something far more serious than an awkward moment. It could lead to a heart attack or stroke. It's true, aging changes your body. Testosterone drops, muscle mass declines, blood vessels become stiffer, and your heart works a little harder to pump blood through your system. But here's the truth most men never hear. Aging doesn't cause erectile dysfunction. Unhealthy aging does. Many men in their 60s, 70s, even 80s still have a healthy sex life. What separates them from those who struggle? It's not just luck. It's lifestyle. Let's break it down. One key factor is testosterone, the hormone that fuels libido, energy, and erectile function. After age 30, testosterone declines about 1% per year. But low testosterone alone doesn't always cause ED. In fact, plenty of men with low T still have firm erections because their cardiovascular system is in good shape. Another factor is nitric oxide, a molecule your body produces to relax blood vessels and increase blood flow. As you age, your nitric oxide production decreases, but here's the good news. Exercise, sleep, and a healthy diet can boost it naturally. Now let's talk about artery health. Aging contributes to arterial stiffness, which makes it harder for blood to flow where it's needed. But studies show that regular physical activity can actually reverse vascular aging to some extent, improving both heart and sexual health. So while aging may be part of the story, it's not the ending. Blaming age is easy, but it lets you off the hook. The reality is, poor diet, sedentary behavior, smoking, and chronic stress age your arteries much faster than the calendar does. Bottom line, if you're over 60 and struggling with ED, don't. Just chalk it up to getting old. There's a good chance your body is asking for help. And with the right changes, it's never too late to answer the call. Here's something many men never hear from their doctor. The pills you're taking for your heart may be quietly sabotaging your sex life. Let's start with beta blockers, a class of drugs commonly prescribed for high blood pressure and heart disease. While effective at protecting your heart, they can also reduce blood flow and dull the nerve signals involved in arousal and erection. The result? ED that seems to come out of nowhere. Then there are diuretics, or water pills, which reduce blood pressure by helping your body get rid of excess sodium and water. But they also deplete zinc, a mineral critical for testosterone production, and reduce blood flow to the penis. Antidepressants, especially SSRIs like fluoxetine or sertraline, can also disrupt sexual function. They may calm the mind, but they often numb desire, delay orgasm, and make it harder to achieve an erection. Ironically, many seniors are prescribed these medications for anxiety or sleep and never realize the side effects. Now, this isn't a message to throw away your prescriptions. Absolutely not. Never stop taking heart medication without your doctor's guidance. But if you're experiencing ED, it's worth having an open conversation with your healthcare provider. There may be alternative medications or adjusted dosages that protect your heart without sacrificing your intimacy. And don't be embarrassed to bring it up. A study from the American Urological Association found that most men wait over a year before discussing ED with their doctor. That's a year of unnecessary suffering and a missed opportunity to fix the problem. The medications you take are meant to help you live longer, but you also deserve to live well. Your quality of life, including your sex life, matters. Let's shift gears from problems to solutions. The great news is that the same habits that strengthen your heart can also reignite your sexual health. You don't need a cabinet full of pills. You need consistent, science-backed choices that support your cardiovascular system from the inside out. Start with your diet. The Mediterranean diet, rich in olive oil, fish, nuts, fruits, vegetables, and whole grains, has been shown to reduce the risk of both heart disease and erectile dysfunction. One study published in the Journal of Sexual Medicine found that men who followed this diet had improved erectile performance compared to those eating a typical Western diet. Foods that boost nitric oxide, like beets, spinach, arugula, and watermelon, relax blood vessels and improve circulation. These aren't just good for your heart, they're nature's version of a little blue pill. Cut back on processed sugars, trans fats, and excess salt. They stiffen arteries and inflame your body from the inside out. And don't forget hydration. Even mild dehydration reduces blood volume, which can affect both energy and erections. Exercise isn't optional, it's essential. Just 30 minutes of brisk walking a day can reduce the risk of ED by 41%, according to Harvard researchers. Strength training, swimming, yoga, whatever you enjoy, get moving. It boosts testosterone, increases blood flow, and supports a healthier mind. Lack of sleep disrupts hormone production and increases cortisol, the stress hormone that constricts blood vessels. Aim for 7 to 8 hours of quality sleep per night. No screens in bed. Keep the room dark and cool. Sleep isn't just recovery, it's repair. Some men benefit from natural supplements like L-arginine, citrulline, and CoQ10, all of which support nitric oxide production and mitochondrial energy. But quality matters. Look for products that are third-party tested and always consult your doctor to avoid medication interactions. Chronic stress keeps your body in fight-or-flight mode, raising blood pressure and constricting arteries. Even 10 minutes a day of deep breathing, mindfulness, or gratitude journaling can lower cortisol and improve vascular health. Uncontrolled blood sugar damages blood vessels and nerves. If you're pre-diabetic or diabetic, ED can be one of the first complications. But with dietary changes and regular exercise, blood sugar levels can often be stabilized without medication. Smoking narrows blood vessels, making erections harder to achieve and maintain. And while a little red wine may be heart-friendly, too much alcohol is a known erectile depressant. Choose moderation over indulgence. You don't need a miracle, you need a plan. Every walk, every healthy meal, every night of good sleep brings you closer to a stronger heart and a better sex life. Your body is incredibly responsive. With time, care, and consistency, it's possible to reverse years of damage and reclaim the vitality you thought was gone forever. Let's talk about something that often gets overlooked, your mind. Because even if your heart and hormones are in perfect shape, your thoughts can still get in the way. Stress, anxiety, and depression are powerful forces, and they don't just affect your mood, they directly interfere with sexual function. When you're under chronic stress, your body produces cortisol, a hormone that narrows blood vessels and restricts blood flow. That means less circulation where you need it most. Performance anxiety, fear of failure, or past trauma can also trigger a mental block, which makes it harder to get or keep an erection, even if everything else is working just fine. The brain is just as important as your arteries when it comes to intimacy. Depression is another major contributor. Not only can it reduce your desire, but it also impacts the release of dopamine, the feel-good chemical that drives arousal and pleasure. Worse, many antidepressants can create a double-edged sword. They treat the mood but dull sexual response. So what can you do? Start with stress management. Daily deep breathing, prayer, meditation, or guided relaxation can reduce cortisol levels and improve blood flow. Even a few minutes a day can make a measurable difference. Cognitive behavioral therapy, CBT, is also highly effective in treating both ED and the anxiety that surrounds it. And here's a big one. Talk to your partner. Open, honest communication can ease pressure and strengthen emotional intimacy, which often leads to better physical connection too. Bottom line, your body and mind are a team. Treating one without the other is like fixing a flat tire, but ignoring the engine. For real, lasting improvement, you have to care for both. If you've been experiencing erectile dysfunction for more than a few months, it's time to stop guessing and start talking to a doctor. ED isn't something to hide from. In fact, it might be the first clue your heart is in danger. So when should you seek help? If your erections are consistently weak or absent, if your desire is intact, but performance is unreliable, if you have other risk factors like high blood pressure, diabetes, or high cholesterol, don't wait for a crisis to act. The penis is often the first place vascular disease reveals itself, sometimes years before a heart attack strikes. That makes early detection not just helpful, but potentially life-saving. When you see a doctor, you may be referred to a urologist or cardiologist, depending on your symptoms. Common evaluations include blood tests for testosterone and cholesterol, a blood pressure check, and sometimes a penile Doppler ultrasound to examine blood flow in real time. Yes, it might feel uncomfortable at first, but remember, your doctor, has heard it all before. You're not the first man to deal with this, and you won't be the last. What matters is that you take action now. The earlier you intervene, the more options you have, not just for treatment, but for reversal. This isn't just about your sex life, it's about your whole life. You don't need to change everything overnight, but you do need to start somewhere. The good news? Small steps lead to big results, especially when it comes to your heart and sexual health. Here are 5 powerful actions you can take this week. Walk for 30 minutes every day. Eat 1 green meal a day. Schedule a doctor's appointment practice. 5 minutes of deep breathing track your progress. The goal isn't perfection, it's progress. Every small change is a message to your body. I'm listening and I'm taking action. Erectile dysfunction isn't just about intimacy, it's about information. It's your body's way of speaking up, of telling you something's off beneath the surface. And in many cases, the real issue lies in your heart. But here's the good news. This isn't a life sentence. It's a wake-up call. And you have the power to answer it. With movement, with nourishment, with awareness, and with courage. You deserve more than just surviving. You deserve to thrive. So talk to your doctor. Start that walk. Make that one change today. And if this video helped you see the bigger picture, share it with someone you care about. You never know who's silently struggling with the same questions. Leave a comment. Subscribe for real health advice that matters. And don't forget to like this video, because sharing truth could literally save a life. Your best years aren't behind you. They might just be one healthy habit away.